For more insightful conversation, we now go to studio Professor Carl Harrop, PhD and Chairperson of Cell Biology and Neuroscience at Rutgers University. We're talking about Alzheimer's disease, and of course this is growing as the population gets older. Are there new developments in the treatment of this? What are we seeing?
Well, there's a lot of new research going on. Treatment, I think, is still an elusive goal for all of us. I like to say that Alzheimer's is probably one of the most complex diseases to affect the brain of people, and befitting that complexity, working out an effective treatment, either prevention or curative, has been very, very difficult.
Mm-hmm. And how do you explain what the disease is exactly? You say sometimes people don't really realize.
So it is complex, and we all tend to use the shorthand of being unable to remember something that just happened. But in fact, if you really pick apart the symptoms of the disease, there's the short-term memory loss, but there's also the inability to do a complex task. We call it executive functioning. There's behavioral changes like depression, apathy. You lose the ability to orient yourself in space, which is why we hear about Alzheimer's patients wandering around their neighborhood. A wide range of symptoms, and they're all part of the disease, and they go well beyond just the ability to make the short-term memory happen.
You know, it's interesting how insidious this disease is, and I only talk about it. My father had Alzheimer's, and it ultimately took him. But the thing that was common that we found, you think that it's just because someone's getting older, they're getting forgetful, and you don't realize the symptoms until something bizarre happens. Right. Then you end up going to a professional and say, oh, wow, this is what we're dealing with. And I've got to tell you, it seems to me to be tougher on the caregivers than it is on the patients.
There's no question about that, and there's even a lot of work on exactly that topic. The loss of, in terms of their own health, their own mental well-being, even their own ability to hold a job suffers dramatically in the people who are closest in actually giving the care to the patient.
Sure.
The patient themselves, ironically enough, is very often unaware of what's happening to them, and in many ways unperturbed by it. That's not always true, but the caregivers take it on the chin.
You know, it's the little things that you notice. My father was he liked to cook a lot. He would take something and put it on a paper plate and say, I'm going to go heat this up. And I'd have to stop him and say, well, wait a minute, Dad, it's a paper plate.
Right.
So it's the little things like that kind of, after a while, you get a sense that something's wrong, but you really don't notice it in the beginning.
Right. And it's all individual. It's not just, you know, for someone else, unlike your father, that would have been a common everyday occurrence since they were 30. The deal is that it's the change in the one individual that makes the difference.
So it's more than just an elderly person being forgetful. I think that's what a lot of us just assume.
Right. Oh, definitely. Right. Definitely. It's a real disease. It has a real biology. You know, we sometimes have trouble saying exactly when it starts, but it's not normal aging.
Like, was there a particular turning point for you that with your dad, that you noticed something?
Oh yeah,
was way out of whack?
There was a point that behavior became really bizarre, and we had to say, look, this is more than just being forgetful. Let's go see a neurologist or see some behavioral experts. Mm-hmm. One of the frightening things about this is that as the baby boomer population gets older and people are being diagnosed at a younger age, now we have an exploding population of people with Alzheimer's disease.
Right, and I think you've hit it. It actually hits at both ends. So we are able to recognize the symptoms earlier and begin to identify people who have the disease. Plus, as a population, we're living much, much longer, which means more of us are likely to get the disease. It's a disease of aging. It doesn't really strike the young, but so in many ways it represents a triumph of modern medicine. We now all live long enough to get it. You know.
As far as causes go, are we looking at any particular area?
There are some reigning models of the disease and what the underlying biology is, and I would say that they are far from settled, and that's reflected, in fact, in the actual disappointing period of clinical trials we had last year, where they tested some very, very promising drugs based on these early models, and they just all came up short. Actually, one of them made the patients worse, and we had to just end the trial early.
Well, there was one that seemed to be promising. Aricept came on the market, I believe, maybe a couple, 2-3 years ago, maybe a little longer, but it seemed to have a good effect over the short term.
Aricept is actually still in usage. It is still a very good drug, but Aricept deals with the symptoms. It doesn't actually change the underlying course of the disease. So it's useful for a patient to give them a bit more time with a higher quality of life, but it's not able to change the course of the disease.
Okay,
Wow.
thanks.